is Elisabetta Biasin, if I name you correctly. She's researcher in law at KU Leuven Centre for IT and IP Law. And actually, she's currently involved in several e-health research projects like Made for You and Careables.org, which is actually tackling some of the points that Harold was mentioning in terms of what is needed, in terms of, support. More broadly, those projects are supporting designers, engineers to work with practitioners in the health field to bring about open and collaborative products. And she herself is focusing on the ethical and legal issues related to open source in healthcare. So it's a great pleasure to have you here, Elisabetta. Over to you.
Thank you very much. I will start I will start sharing my screen. Okay, can you see my presentation? Is it visible?
Yeah.
Okay. Okay, so hello everybody. Thank you very much to Wikifactory for inviting me here. What I would like to do today is to share my experience within the Made for You project and the Careables.org project. And I would like to, of course, reply to the question how to audit and secure accreditation for COVID-19 product. I'm a researcher in ICT law. So in the Made for You project, I'm currently researching all the ethical and legal issues related to the development of open source hardware project in open collaborative platforms. And legal issues range from IPR to intellectual property, to rights, to tort law, to medical devices law, to privacy and data protection law, which is also relevant for open source hardware and also to additive manufacturing. So what I would like to bring is, and to tackle the question of this panel, is to bring 3 points. One concerns the context, one concerns the legal framework that we are going to speak about, and one concerns a little bit the recommendation I would like to share in light of my experience in the Made for You project and the Careables.org. And also what I have learned so far by exchanging my views as a legal, as a lawyer with makers and designers for the developing of healthcare solutions. So the context right here at the moment is, ever since the spread of COVID-19, communities of fabless makers have been joining forces to design and reproduce healthcare solutions. And we have had many examples. At the moment, I may report, for example, Isinova. And since I am Italian speaking, I have the Italian cases as the first that comes to my mind. Like, for example, the use of respiratory masks in some hospitals in northern Italy. And I think this is a very important thing to report in this context. What I would like to share here is a little bit my input on navigating the law. So if you are actually developing open source hardware healthcare solutions, what should you take into account? And I would like to focus, of course, on medical devices. I think that the first question that should be tackled is, what are the legal frameworks that need to take into account? Of course, there is privacy, data protection, and intellectual property, which is really important. But now I would like to talk about medical devices and law, and also personal protective equipment law. I'm established and researching in Leuven, which is in Belgium, and I'm following a Horizon 2020 project. So my knowledge is limited to EU-wide legislations and Italian legislation. But I'm trying to provide some kind of general insights that might be applicable also, let's say, with general principles for other experience that are outside the EU. I think that it's really important when somebody develops a medical device to understand whether it is a medical device or it is a personal protective equipment. Like, for example, and also it's really important to understand, at least in Europe, whether the designer or the maker is operating within a commercial context or is doing a solution, replicating a solution on his own. This has changed a lot, and it also implies different kind of also liability and also rules with respect to product rules. Developing an object means that it might qualify as a medical device, but there are some cases in which it's not so easy if you do not have a legal background to understand whether it is a medical device or something else. And I would like to bring here the example of masks, let's say, the COVID-19 masks. So, for example, we have different kind of masks, like surgical masks that are regulated as medical devices. And these are medical devices. But when designing also masks that are for everyday use for citizens, these are not, of course, they might not be surgical masks, and they might be fall within the definition of other kinds of masks. Like in Italy, we have the so-called filtering masks. That is a different kind of mask. And also, it's really important to understand whether it is a medical device or a personal protective equipment, because it also implies different kinds of regulatory frameworks. And also it implies that different kind of regulatory authority might be necessarily addressed by the manufacturer for medical devices. And in Europe, medical devices law is regulated at EU level with the medical device directive, and within some years we applicable also the medical devices regulation. Whereas personal protective equipment regulation is directly applicable in all member states, and it's a regulation that has been issued at EU level, whereas now different kind of legislations apply differently for medical devices law. Also, so another thing that I would like to add is once you understand whether it's a medical device or a personal protective equipment, and especially for medical devices, it's crucial to understand what kind of medical device is, because depending on the kind of medical device that you are actually manufacturing, it implies also a different kind of risk assessment, and medical devices might be of different classes depending on the risks that they imply to patients' health and safety. So depending on this, you may face different kind of regulations, and you may need to comply with different kind of regulatory legal requirements. And to do so, it's really important in Europe, for example, to take care of analyzing medical device classification rules to understand. And there are also really important guidelines at EU level that provide several examples on which kind of medical devices might be, with some practical examples as well. Finally, going back to my previous experience with careable.org project, I also wanted to provide other kind of recommendations that I've recently wrote about for another contribution. And I think this is very useful when operating in collaborative platforms such as careables.org or other kinds of platforms where designers are uploading their designs and someone else downloads the design and reproduces it. So with my team, we wrote down 4 key recommendations. The first is a ethical one. it's a principle of not doing harm and be responsible. So while designing a solution, whether or not it may qualify as a medical device, it should be done responsibly. Also, it's really important, as I was presenting before, to evaluate the applicability of different kind of legal frameworks for medical devices, their safety, and as well to make a proper risk assessment. Another, let's say, less legalese and more user-friendly recommendation was keep calm and choose a license, meaning that when you upload something on a collaborative platform and you wish to have it free use, it's always important to remember how to manage, and decide what kind of license you want to use for your designs. And also, it's really important always to remember that when you share your knowledge on collaborative platforms, you really also need to remember that those platforms have a global reach. So if you are designing with someone else in another state, which applies different kind of laws, this is also important to take into account. And also, if you, for example, manufacture something in certain states and you want to sell it over another state, you also need to take into account these kind of factors. So it's really important, something that it's not always the first thing that you would think about, but it's also important to think about. And also, with respect to the COVID-19 epidemic, some governments have provided ad hoc waivers or specific guidance for the manufacturing of some kinds of COVID-19 solution in a swifter way. So, for example, the European Commission has issued a month ago guidance on 3D printed products, or for example, Italy had also provided some kind of less detailed waivers, but some kind of legal provisions that are relevant to COVID-19. And also, as far as I know, also the Netherlands have provided some kind of waivers. So this is a bit what I wanted to present today in a very synthetical way. And if you wish to find some more detailed overview, we are writing some reports that concern legal challenges for open source hardware in healthcare, and me and my colleague Eric Kamenjasevic. And of course, today I just wanted to provide a brief overview of what I think it's really important to focus on while addressing the most relevant legal requirements for medical devices in healthcare. So thank you very much for your attention, and I'm happy to continue the discussion.
Excellent, Elisabetta. Thank you very much.
Thank you.
I agree with you. It's fantastic that, at least from my knowledge as well, from the EU perspective, that there are waivers of fees and access to standards, and that kind of information is made directly accessible and for free in many cases, and that, you know, in many countries and regions are thinking about funds to actually cover the costs of these COVID-19 products.